Good day, nurses! Welcome to our channel, JRN Review Academy. Guys, magbibigay po tayo ng ilang question na pwede po natin magamit pagdating natin sa actual board examination. And this is all about your endocrine disorder. Guys, huwag po natin kalimutan na tayo ay mag-like, share, and subscribe para dire-diretso po ang pag-upload ng ating mga video. Okay guys, simulan na po natin ang question number 1. Okay, question number 1. The client with Pheochromocytoma should be instructed to avoid activities that precipitate hypertensive crisis, such as A. Jogging, B. Valsalva maneuver, C. Anxiety, and letter D. Hypoglycemia. Is it A, B, C, or D? Okay, the correct answer is your letter B, Valsalva maneuver. So, bakit ito, guys? So, ito yung kailangan natin i-avoid na activities for this kind of client. Okay? To prevent the hypertensive crisis. Remember your Valsalva maneuver, it increases the cardiac workload and precipitate hypertensive crisis. That's why this should be avoided by the client with Pheochromocytoma. And Pheochromocytoma disorder of your adrenal medulla. There is a tumor that originates from the adrenal medulla, and based on the study, it is usually benign, but 10% are malignant. And remember, there is stimulation or it stimulates hypersecretion of catecholamines like your epinephrine and your epinephrine. That's why nagkakaroon tayo ng overactivity ng ating sympathetic nervous system. Kaya naglalabas tayo ng clinical manifestation, and your clinical manifestation start with the letter H. Hypertension, hyperglycemia, headache, hyperhidrosis, and hypermetabolism. So yun yung 5 clinical manifestation na meron ang pasyente na merong Pheochromocytoma. Okay? And also, the laboratory test that specifically support the presence of your Pheochromocytoma is what we call the VMA test. Okay? Simpleng tanong, VMA test, paano siya ginagawa? It requires 24 hours urine specimen collection. Simpleng tanong again guys, kapag to 24 hours urine collection ka, para sa VMA, meron tayong kailangan i-avoid na makaka-alter sa ating resulta, like your coffee, tea, chocolate, banana, and your aspirin, kailangan ma-avoid natin yan sa pasyente para wala tayong alteration ng resulta. Okay, so the correct answer number 1 is letter B. Question number 2. The primary features of Pheochromocytoma's effect on blood pressure is systolic hypertension, diastolic hypertension, hypertension that is resistant to treatment with drugs, and D, widening of pulse pressure. What is the correct answer? Okay, the correct answer is your letter C, hypertension that is resistant to treatment with drugs. Okay, so guys, kung ganyan, ano yung dapat nating gawin? Ano yung pwede? Surgical management. And your surgical management is what we call your adrenalectomy. Okay? Adrenalectomy. Because your Pheochromocytoma is a tumor in the adrenal medulla that stimulates increased secretion of catecholamine. This is primarily characterized by hypertension that is resistant to treatment with drugs. Kaya mas okay kung surgery or surgical management ang gagawin, which is your adrenalectomy. So the correct answer is letter C. Question number 3. Which of the following findings would be typical for Addison's disease? A. Hypokalemia, B. Hypernatremia, C. Hypoglycemia, and letter D. Decreased BUN level. So the correct answer is letter C. Okay? The correct answer is letter C. Okay, so letter C. Why not A? In Addison, it should be hyperkalemia. Your letter B, it should be hyponatremia. Okay, because of decrease in mineralocorticoid. Okay, decrease in salt. And letter D, hindi po kasama. Your letter C is hypoglycemia because of decrease in your glucocorticoid, decrease in sugar. So this is typical of Addison's disease. So in Addison, guys, in Addison's disease, there is decrease. Mababa po ang glucocorticoid, sugar. Pag mababa po ang sugar natin, mababa po tayo or meaning hypoglycemic ang pasyente natin, lead to fatigue. There's also decrease in mineralocorticoid, the salt. Kaya sabi natin kanina, weight loss, weak pulse, dehydration, and hypotension. And also the sex hormones in female, change menstruation in female, and impotence naman kapag sa lalaki. So tandaan natin in Addison's, lahat po mababa except yung potassium level which is hyperkalemia. And remember guys, since hyposecretion yung ating adrenal hormones, the anterior pituitary gland, tataas po ang secretion which is your melanocyte stimulating hormones. At pag mataas po yung melanocyte stimulating hormones natin, tataas po yung tinatawag nating skin pigmentation. Okay? Yun po yung sanhi kung bakit nagkakaroon tayo ng hyperpigmentation sa balat ng pasyente na merong Addison's disease. At yun po yung tinatawag nating bronze skin pigmentation. Okay? So remember guys, in Addison's disease, everything is slow except your potassium. This is hyperkalemia. Question number 4. PTU is prescribed for a client with Graves' disease to decrease circulating thyroid hormones. Pag sinabi natin Graves' disease is hyperthyroidism. Okay? So to decrease circulating thyroid hormones, the nurse should teach a client to immediately report which of the following signs and symptoms? A. Sore throat. B. Painful excessive menstruation. C. Constipation. And letter D. Increased urine output. So guys, alin daw dito yung pwedeng side effect nung pasyente na nagtitake ng PTU na kailangan nating i-report sa doktor. Okay? Kailangan i-report agad sa attending physician. Letter C. So, the PTU is your anti-thyroid medication. So, and the function of this is it inhibits the synthesis of your thyroid hormones. And again, remember the side effect na naku-question po sa board examination, the side effect of your PTU is agranulocytosis, neutropenia with leukopenia. So ano yung mga side nito? Your fever, sore throat, and skin rashes. Tandaan niyo po yung guys. We need to monitor your patient blood pressure and pulse rate, hypertension, and your tachycardia. And we need to avoid the aspirin and iodine-containing medication sa pasyente natin. Bakit bawal ang aspirin? It elevates the free thyroid hormones level. Mas tataas pa. As well, yung iodine-containing medication natin, ma-stimulate yung thyroid function and antagonize yung anti-thyroid medication. So, nagkakaroon tayo ng counter. So, kaya kailangan natin i-avoid sa pasyente na to. Should be instructed. Question number 5. Nurse Frank is aware that a positive Chobostek sign indicates A. Hypocalcemia, B. Hyponatremia, C. Hypokalemia, and letter D. Hypermagnesia. So, yung pasyente mo daw is may positive Chobostek sign. Okay. So, the correct answer is your letter. Okay, letter A is the correct answer. Chobostek sign is elicited by tapping the client face lightly over the facial nerve. So, if the client muscle twists, it indicates hypocalcemia. And your letter B, hyponatremia, guys, indicated by weight loss, abdominal cramp, muscle weakness, headache, postural hypertension. And your letter C, hypokalemia, it causes the paralytic ileus and muscle weakness. And letter D with hypermagnesemia, exhibit a loss of deep tendon reflex, coma, and cardiac arrest. So, in Chobostek sign, it indicates your hypocalcemia. Correct answer is letter A. Question number 6. What are the functions of T3 and T4? A. Retention of salt and water. B. Maintenance of blood sugar. C. Maintenance of blood pressure. And letter D. Regulation of energy production. What is the correct answer? Okay, the correct answer is your letter D. Regulation of energy production. The function of your T3 and T4 is to regulate metabolic rate or metabolism. So, if there is increased T3 and T4, it indicates hyperthyroidism. Pag kumakain po tayo, guys, ng meal natin, okay, so the glucose should be transported inside the cell. Okay, dapat mapunta yung kinain natin o yung sugar sa loob ng cell natin, hindi sa blood. Okay, inside the cell. And magre-react dapat ito sa oxygen natin. Okay, para magkaroon tayo ng energy at para makapag-benefits tayo ng tinatawag nating 3 basic component or concept of beneficial product. So, ano ba yung mga tinatawag natin? Your ATP. So, one basic concept or beneficial product is your ATP, which is your energy. So, ito yung ginagamit natin. Another byproduct is your water. There is a water production na kailangan ng katawan natin, okay, for fluid. And number 3, heat production to maintain body temperature. So, this is the 3 beneficial byproduct or 3 concept of our metabolic rate. So, in hyperthyroidism, guys, if you have increased ATP, sabi natin, in hyperthyroidism, there increased T3 and T4. So, expect natin na in hyperthyroidism, mataas ang kanilang ATP, which is your energy. Saan? Sa brain. Okay? Pag mataas ang energy natin sa brain, will lead to insomnia, irritability, and agitation. If there is ATP in the heart muscle mataas, it will lead to your tachycardia and hypertension. If there increase ATP in our GI, it will increase appetite, diarrhea, increase ang peristaltic movement, and weight loss. Okay, nagkakaroon tayo ng weight loss because of our diarrhea as well. And your muscle is your fine tremors. Also, there's increase in water production. Sabi natin, in T3 and T4, there is increased water production. Another sign and symptoms, if there is increased water production at the back of your eye, that's what we call your exophthalmos. And this is common in the board examination, the sign and symptoms. So, because of water accumulation at the back of your eyeball. Pag wala si exophthalmos, pwedeng si lid lag, pwede rin naman ang bright eye stare. And remember guys, exophthalmos is irreversible. And skin There's a water production. So, diaphoresis, maraming magpawis. So, ang ating pong skin, smooth and moist. Then, there's increased production of heat. So, ang pasyente natin is heat intolerance. Common din po sa board examination. Question number 7. A patient is admitted to the medical unit with possible Graves' disease or yung tinatawag nating hyperthyroidism. Which assessment findings supports this diagnosis? A. Periorbital edema, B. Bradycardia, C. Exophthalmos, and letter D. Hoarseness of voice. So, na-discuss na natin to kanina. What is the answer? Okay, answer is letter C because of accumulation of fluid at the back of your eyeball. Okay, and this is irreversible. Pag wala si exophthalmos, andun si lid lag, pwede rin ang bright eye stare. Correct answer is letter C. Okay, question number 8. A client with DM asked the nurse to recommend something to remove corns from his toes. The nurse should advise him to apply high-quality corn plaster to the area, B. Consult his physician or podiatrist about removing the corns, C. Apply iodine to the corn before peeling them off, and letter D. Soak his feet to borax solution to peel off the corn. So the correct answer here, letter boy. Must consult his physician. Okay? Question number 9. A client has undergone a subtotal thyroidectomy, is subject to complications in the first 48 hours after surgery. The nurse should obtain and keep at bedside equipment: TPN, cut down, tube feeding, tracheostomy set. The correct answer is letter D. Okay? The parathyroid gland may be damaged during thyroid surgery. This leads to hypocalcemia, which causes laryngospasm and airway obstruction. Tracheostomy set should be made available for emergency purposes. So, kailangan po natin ng tracheostomy set post-operative na nakaset po siya doon, readily available for the patient. What else? Aside from your tracheostomy set, ano pa yung kailangan natin is your oxygen and suction machine. Okay, so the answer is letter D. Okay, question number 10. Which of the following signs and symptoms causes concerns and requires nursing intervention for a client who recently had a thyroidectomy? A. Heart rate of 130, blood pressure of 220, and temperature of 103. B. Heart rate of 35, blood pressure of 60, temperature of 95. C. Soft hair, irritable, diarrhea. D. Constipation, drowsiness, and goiter. So, which of the following daw sign and symptoms causes concern and requires nursing intervention? So, maaari ang pasyente natin dito nagkaroon ng thyroid storm due to the procedure of thyroidectomy. Okay? So, the correct answer is answer is letter A. This is the sign and symptoms of your thyroid storm. The heart rate of 130, which is your tachycardia, the blood pressure of 220, this is systolic hypertension, and the temperature of 103 is your fever or hyperthermia. This is a clinical manifestation of patient with thyroid storm. So, paano ba nangyayari at nagkakaroon ng thyroid storm? This is due to the release of your thyroid hormones into the bloodstream during surgery. Okay? And also, follow severe infection and stress. So, the correct answer is letter A. So, again, magbibigay pa tayo ng mga ilang questions sa mga susunod na video para pagdating natin sa actual board examination, meron tayong mga baon. Thank you very much again, guys, for listening. And please don't forget to like, share, and subscribe sa ating channel para tuloy-tuloy tayo ng pag-upload. And again, thank you very much and good luck on your examination.